So today I want to talk about how we can help prevent tears, particularly ACL tears during the basketball season. So basketball season right here around Charlotte, North Carolina, right around the corner. And just want to talk about a few things that are actually in our control. I know it's late, but there are some things that we can do to control right now the potential to tear the ACL. So as a reminder, we're going over this and having this discussion because it's the most commonly disrupted ligament in the knee. As a heads up for the parents out there, women are up to 9.7 times more likely to tear the ACL than the men. So guys should still be mindful of this and everything I have to say, but women particularly need to be more mindful of everything I'm about to say because we really don't want to suffer an ACL tear for obvious reasons. Some reasons that women are that much more likely to tear compared to men will be actually hormonally, all right, can cause some weakness in the ligaments that can cause an increased chance in ACL tear. Too much friction, now that's really the same for both men and women, but if you wear shoes that actually have too much friction on the court, that can yield an increased likelihood to tear. As a reminder, ACL tears are done 70% of the time from a non-contact injury, which means people aren't even running into them and they're tearing their ACL. Shoes or anything that has too much friction might be one reason to explain that. Women do have traditionally wider hips and smaller femoral notches. You don't really need to know what the notch is, but just know that there are anatomical reasons and rationale why the women might have more of a chance to injure themselves. And then also neuromuscularly, and again, this is really true of probably both men and female, but more so female, this is one that we can control, which is great. This is one that we can really positively impact our ability to decrease the chances of tearing our ACL. In other words, what neuromuscular means, we can have improved control. We can teach improved strength. We can teach improved shock attenuation. And what I like to do is go ahead and show you a little bit of kind of what we're talking about here. All right, so this is an example of one way we could potentially screen someone. This is just one of many ways to see how well neuromuscularly they're kind of in control of that leg. So as I'm going through this jump, this is again just one way, but I want to see how well I land. I want to see what my hip position's in. I want to see if my knee is in good alignment or not. And I wouldn't want to see this. So I was really wobbly there, right? And so we don't want to see that wobbliness or that poor coordination. So, and this is something that you can do asymmetrically on both sides, which is super nice about it. Because a lot of times I see athletes are compensating from one side compared to the other. So that's a really quick example of one way that we can assess their ability to attenuate force, and then it gives me a good idea of how much potential force is going through the ACL. Women tend to be much more quad dominant, so a lot of times we're retraining the hamstrings, we're retraining the calves, not just to get stronger, but to fire and to fire appropriately so that the quad's not the only one working so hard. When the quads work that hard, it can cause a shear force to the ACL. So I know basketball season is just about to start, but it's not too late to prevent an injury, all right? What we don't want is that your poor child suffers a bad ACL tear, and I haven't even spoken about how a lot of times it's combined with meniscus injuries. There can be fractures with it and a lot of uglier stuff, but on average, athletes are out for a year or more because of this, and on average, the cost for the surgery is around $47,000. So hopefully you got good insurance, but we really don't want to have that discussion. So rather, I'd like to have the discussion of screening your athlete right now. It's not too late, and I know it can be challenging with schedules and kind of getting into the middle of basketball season, but it's definitely been done, and we could basically help screen your athlete, see where they're at, see if they're at risk, and then if they are at risk, we could start to make some nice drastic steps in the right direction to significantly decrease their chances of tearing the ACL and letting them just enjoy and play hard for the sports season. So I hope that was helpful. I just want to hop on real quick, and you guys have a great rest of your day.